I have a number of questions related to our nursing homes, which have sadly been the epicentre of deaths as a result of COVID-19. Minister, at the beginning of this health crisis, the decision was taken by the HSE to clear hospitals of older people and transfer them to nursing homes in anticipation of the surge of COVID patients. This was deemed by the HSE, and I quote, as a necessary risk. But this, I believe, was deemed a necessary risk solely to avoid bed blocking in our hospitals. I would like to know what measures were taken to assess the risk posed by these transfers to older people already residing in nursing homes. Minister, will you direct the HSE to publish the risk assessment which deemed this transfer of patients to nursing homes as a so-called necessary risk? I have asked your department via parliamentary question for the publication of this risk assessment over 2 weeks ago. The response that I have received referred to the 4th revision of the discharge guidelines, not the original version, which was focused on getting people out of hospital, full stop. Minister, my fear is that no risk assessment on the impact on nursing home residents was carried out before the decision was taken to move patients from hospitals to nursing homes, and as a result, the proper protections for nursing home residents were not put in place. Some of these discharges, sadly, became the vector for the spread of COVID-19 in those nursing homes.
Naughten for raising this issue, and I will certainly direct the HSE to share any information that they have with the Deputy, because they should and they should want to, because I believe they did everything they possibly could. And I wouldn't share the view of the Deputy on this regard, that it was simply to reduce bed blocking or any phrase like that. I think if we think of it, there was a view that our hospitals were going to be a very dangerous place, often a place in which you pick up an infection, and the idea that we could get people out of that and looking at what was happening in other countries. But yes, I absolutely will direct that happens. I do think we need to be careful. I don't wish to use the Deputy's time up in this regard, but there are many ways, obviously, an infection can get into any setting. There's the fact of visitors, and the CMO has shown evidence in relation to how that doesn't work. There is obviously people being admitted, but there is also obviously the fact that staff have to go in and out and to provide really essential care and services. And I do think we need to not predetermine, I think, how that virus get into those settings.
Minister, I agree with you that another vector was clearly staff, and yet it took weeks before staff and residents of nursing homes were screened for COVID-19. As you know, 21 days ago, I asked that all residents and staff be re-screened due to the inordinate delays in returning the original test results. On that occasion, Minister, you promised me that this would happen. So when will the residents and staff in nursing homes be retested? The reason why I am so concerned by this failure to retest is because the time delay between taking the tests, the original swabs, and the results is undermining the credibility of the screening programme. In one instance that I'm aware of, a frontline nursing home staff member had to wait 13 days for an asymptomatic positive result, during which time she continued to work in that nursing home. This person worked in a large nursing home in the east of the country, yet amazingly, the HSE had no plan to retest the residents or the employees of the nursing home in question. Minister, what was the purpose of testing in that nursing home? In other instances, people waited 3 weeks to be told that no test result was available and they had to be retested. What is the benefit of testing in these instances, where it can take in excess of 24 days to inform someone that they are asymptomatic positive? Testing and delivering results in the shortest time possible is key to success in managing COVID-19. The delays that we've seen are totally unacceptable and contribute to the spread of the disease. So what I would like to know from you, Minister, can you confirm the current turnaround times for informing people of the test results, and whether you believe these are now acceptable?
Minister. Yeah, I want to thank the Deputy. So just to be very clear, I'm told that the average wait from the week since the 18th of May for a swab to result is 1 to 2 days, and overall end-to-end turnaround times within 3 days. But I'll perhaps share the data that I have with the Deputy here rather than taking up his time now. Deputy does make a very important point, though, that testing is only a point in time. And I think he would acknowledge that we've obviously built up a lot of extra capacity now that we can put to work, if you like, in terms of trying to manage and suppress this virus further. The ECDC, the European Centre, has issued some really important guidance in relation to the testing of staff, particularly in the nursing home setting on a regular basis. The National Public Health Emergency Team met today specifically in relation to this, and it will make an announcement later today if it hasn't already while I'm in here. But my understanding is that this will result in all staff in nursing home settings being tested on a weekly basis. For a period of a month. We do know that when we did the last widespread test of all staff and all residents, including asymptomatic, and I think we're one of the few countries in the world to do that, we do know that thankfully the positivity rate was very low, and that the current policy, in addition to what I've just said, is that if a facility does have a first case, all residents and all staff are tested regardless of symptoms.